The problem CHORUS project is trying to address in Nigeria is the linkage system between informal health providers and formal health providers in urban slums in Nigeria.
We did a needs assessment and mapping of all the informal health providers in our selected urban slums. We identified who they are and have them linked into the formal health system. We also now co-created protocols, guidelines, and intervention materials with the formal health providers to be deployed for both the formal and informal health providers.
The CHORUS have done a lot of things, supplying us, the pattern medicine dealers, with a washing hand basin, with a dustbin where we trash our dustbin, with flyers. I have so many flyers here in my shop, which serve as a means of laying information to my customer that there is something like this. It also helped me to know what I'm supposed to do, when to refer, and when to treat. My scope, the one that is within my scope and beyond my scope. They educated us on the importance of good sanitation around the environment, recognition and early treatment of ailments and diseases, and most importantly, referring our patients to the appropriate facilities. That is why they integrated us, the pattern medicine dealers, with the health centers, hospitals, and lab scientists around us.
The people who run these informal health providers are now willing to make referral when they see danger signs. They will quickly make referral, making sure that lives of the people involved are not compromised at some point, and they make the referral on time too.
We also looked at the health management information system by improving surveillance, by having the informal health providers collect data on all the illnesses and cases that come to their domain, because we know that these are missed in the data collected at the health center.
This is a handbook that was given to us during the training. This is our daily facility register, where we register all the treatment done that is under our scope. This is the handbook. We record it down as we are taught. These are the referral. Those that we cannot treat or handle, we use this as a referral. We write a referral note to them that they will take to the health center or the hospital. Then when they are after the treatment, we are expected to bring back a little piece of this book to show us that there was a proper communication between us and the trained health worker that we referred them to.
The challenges we are having is majorly funding. It requires a lot of resources to actually get this job done. Resources from people that will do the supportive supervision, resources for at least moving people from informal health providers to formal health providers in this linkage system. Take, for instance, TPAs that handles pregnant women at the point of delivery. They may meet cases where they don't have people that can actually move these pregnant women, mostly at night, to the formal health providers. This hampers this linkage system to a great extent.
The knowledge and competency gaps that we have identified in the informal health providers pose serious challenges, because some of them, even though they've been trained, they find themselves going back to their old ways of incompetent prescriptions and the rest, because they are money driven. Their services are money driven and they need to make income. So they overlook some of the best practices that could improve quality care. So that is in that case they would need to be retrained and continuous training until their knowledge is quite high and their practices and attitudes change for the better.
Sometimes you refer a patient to health center and you ask them to get the feedback from them. You will find it difficult, as in they will find it difficult to give the patient or our clients or our customers feedback. So you see that there will be a breakage in the relay of information. So secondly is knowledge, lack of knowledge. Our people here, especially in this Ugboye, many so many people I've worked with, they ensure they are not even seeing it as anything. They will look down on you that you are referring them, something like that. So we need enough information, educate them on the system. That is very, very important. If they refer you, that pattern medicine dealers, they are working in partnership with student health workers, and if they refer you, you should take it serious.
We are working on including this project into the government annual operational plan, and of course when this is achieved, the government will now have budget for this program. But policy change is not an easy one. We need to come up convincingly enough for the government to see the results that the CHORUS project have actually given in terms of these services. So we are optimistic that in no distance time, the government will include this in annual operational plan as we are working. And of course, when that is done, the budgeting will be there. But then it doesn't stop partners from coming to intervene. Partners should come and take up this project as a means of assisting the government.
They really equipped us with a lot of knowledge. I say kudos to them, and they should continue to educate most of us. Because if you pattern medicine dealers, most of us are not educated health wise. So with more seminars and workshop, we're able to make some corrections on where we are not doing it well. They'll be able to put us through.